Fox News presents a mental health special report.
Hello and welcome. I'm Sherry Jones. While society has made great strides in the last few years opening up the discussion about mental health, it's still not an easy topic to talk about, and it's still hard for some people to ask for help. So we're going to do a couple of things in the next half hour. We're going to continue the conversation here at the local level, talking to people not just about various aspects of mental health, but about what they're doing and what you can do if you or a loved one needs help. Along with these solutions, we're also running information along the bottom of your screen. You'll be seeing that in just a few minutes. It's contact information for groups who can lend a hand with your mental health. And if you are struggling, we encourage you to make that call. Because we've all been there. Someone asks you how you're doing, and your natural reaction is to say, well, I'm fine, even if you're not fine. So why do we do that, and what can we do about it? Nate Salazar checked in with an expert from the Wellness Institute to find out.
Karen Gallagher, thank you so much for sitting on the couch with us. I appreciate it.
Thanks for having me.
No problem. Well, there seems to be a stigma around mental health. People don't want to admit that they're struggling. Oftentimes when someone says, how are you doing? The obvious answer is, oh, I'm doing fine, I'm doing good. And the reality of their mental health struggles might not come through with that answer. Why do you think that people might do that?
You know, it's interesting because I think our society really encourages people to be fine and encourages life to be fine and that there's no hassles and no issues. And in reality, everybody has challenges all the time, or some of the time at least. It's kind of discouraged to be able to be open and honest about how you're actually feeling, and it's perceived as a weakness, and people don't really want to hear the answer either. They just don't want to spend the time maybe listening in an appropriate way or a helpful way, and they're kind of, everybody's busy, so we want to just kind of scoot, do our own thing. Oh, glad you're doing well, good to see you, and off we go, kind of a thing.
To dealing with your family members. If your family, is there to support you in your mental health, but if you just kind of brush them off and don't tell them what's happening, do you think that sort of the societal pressures also kind of find their way into family and friends?
So family and friends will probably notice that more than anybody, and they might want to ask those questions because they perceive that you're just not yourself, but it is hard to maybe because of the privacy that the person needs or the embarrassment, or they feel embarrassed or shameful about disclosing what's going on, that prevents them from actually sharing what's really happening. And then I really also think that, truthfully, people don't know exactly what's going on with themselves. They might feel kind of sad or bad or worn out, overwhelmed, but they're not exactly sure what's going on. So in therapy, what we do is we help identify and work through what is going on. And sometimes just labeling it and talking about it gives a person quite a bit of relief.
Karen, I want to thank you so much for joining us on the couch and giving us a little bit of your insight.
Thank you for having me.
So instead of the person who says they're fine, what about the person who is asking? What can you do if you suspect that a friend or a loved one is not okay and might even take their own life? Nick Simon asked the experts how to spot the signs and what to do if you see them.
Awareness of mental health issues has been growing nationwide, but many people still don't know what to do when they know someone is going through a crisis. But mental health first aid classes offered throughout mid-Michigan can give you the skills to help people who are hurting. Experts teach how a simple conversation can save a life.
It's better to speak up. Speaking up and getting them connected to help is probably the best thing that you can do, especially early signs. The earlier that we can intervene, the better outcomes that there will be.
But a lot of people don't know how to spot these signs and don't know what to say even if they notice something is wrong. That's where classes like Question, Persuade, and Refer, or QPR, can help out.
Those steps include questions that you can ask, how to give people hope and persuade them to get help, and then how to connect them with resources. So just an hour-long training, providing people with really important skills about how do you have those conversations.
Community specialists also offer a longer 8-hour class on mental health first aid. That gives people a broader look at some of the most common problems that happen with the people that we care about and how to respond.
Everybody's going to know somebody who could benefit from this. So whether it's like a loved one, a neighbor, a student, a peer, a friend, your best friend, grandparents, like elderly is one that we target in the mental health first aid. So it can have a lot of impact for not a lot of time commitment.
That's why officials say that skills like QPR should be just as common as CPR, and they are inviting the community to attend one of the many trainings that are offered by mental health professionals throughout the year.
One of the most important things that we feel we can do to educate and support the community is offering these trainings and increasing people's knowledge and skill for them to be able to connect people to the help that they need.
Here for you in Lansing, Nick Simon, 6 News.
Now, of course, if you're the one who needs help, it is just a phone call away, and that call is just 3 digits, 988. It's almost the 2nd anniversary of that number going nationwide, and we've got some statistics showing how many people that it's really helped. State officials say the Lifeline gets as many as 8,000 calls a month, and this past March, 988 got almost 9,000 calls. That is the 7th highest rate in the nation. Now, on average, those calls were picked up in 17 seconds. Counselors will stay on for as long as it takes to de-escalate a threat. They'll provide resources for people to get long-term help and even call to follow up and check in if you so choose. Well, when we come back, we're going to take a closer look at some risk factors that indicate why some people might take their own lives. And we'll tell you what a local wife and mother is doing to suck out suicide and why. One of the most tragic aspects of mental health is when someone who's suffering doesn't see any way out and takes their own life. Megan Vaselli sat down with a researcher at MSU who came up with a startling statistic about people who commit suicide and what we can do to stop it from happening.
Dr. Jennifer Johnson, thank you so much for being here with us today. Your study found that 1 in 5 adults who died from suicide spent at least 1 night in jail in the year before their deaths. Now, especially given the number of people who struggle with mental health issues and who also end up in jail, I mean, that is shocking. Could you please go into a little bit more detail about the findings of your study?
Yeah, absolutely. So we looked at numbers in 2019, and we found that in 2019, 7 million U.S. adults spent at least 1 night in jail, but they accounted for 1 in 5 adult suicides that year. And it wasn't suicide in jail, it was suicide in the community.
There's a lot of risk factors that people who struggle with suicide ideation, suicidal thoughts, and also people who end up in jail. So it's kind of like the chicken or the egg, which came first. It doesn't necessarily mean that people are attempting to hurt themselves because they were in jail, right? Could you go into a little more detail about that, please?
Yeah, absolutely. So a lot of the really common risk factors for suicide are also common risk factors for going to jail. So they include serious mental illness, trauma, exposure to violence, exposure to other people's deaths by suicide, difficult life events, losing a relationship, losing a job. And, you know, if you know somebody in your life who's gone to jail, it's usually when things in their life are spinning out of control.
What would the ideal situation be for reaching out to people who are struggling, whether it's before or after?
Well, I think the ideal situation is to have more community crisis services in place so that somebody could go somewhere and sleep it off for a couple nights, or they could, you know, be connected to mental health services. So part of what we're working to do is we have several demonstration projects around the country where we found ways to let the community health center or others know, like, hey, your person just got out of jail, you might want to reach out and check in with them. So that doesn't sound like, hey, we heard you're in jail. But that sounds like, hey, you know, Miss So-and-so, how are you doing? We haven't seen you in a minute. Is there anything that you need? And prompting that sort of outreach, we're hoping will help people re-engage with services and prevent suicide.
Dr. Jennifer Johnson, Chair of the Department of Public Health at Michigan State University. Thank you again. I appreciate it.
Thank you.
It's not just researchers working to stop suicide. Okemos High School recently rolled out a unique initiative to tackle the problem. Our Rachel Ramsey caught up with a teacher who has a very personal reason to spread awareness.
People around Meridian Township had the chance to put on their brightest socks for Sock Out Suicide. When you see these socks, they catch your attention, and you have to ask about them, which opens up the door to start a conversation surrounding suicide prevention.
I think the kids know it is a day where it's okay to talk, and it's safe.
Rachel Freeman Baldwin is an Okemos English teacher and brought Sock Out Suicide to the school. Now it's expanded to all of Meridian Township. She says she wanted to start something that could turn pain into advocacy after her husband Ross died by suicide in 2017.
He was known for his very colorful, always matching socks. And we were really looking for a way to honor my late husband, but also to figure out that advocacy piece. Like, how can we tie something that was important to him to something bigger?
Now the event is on its 7th year. Freeman Baldwin says it's a way to get crucial conversations started around mental health.
I don't want anyone to go through what my children and what I have to go through, and it doesn't end. It doesn't end after 1 year. Like, every day is still a struggle. I don't want anyone to have that, pain.
Her coworker and friend Christine Skoutelis reminds people that the message behind the socks is key.
It's not just the socks, right? It's the action that goes with that and the conversation that goes with that.
She says all the schools have a chance to wear colorful socks.
Even at the elementary level, mental health rocks, wear silly socks. So at that level, it's really just about expressing your emotions and talking about mental health. So it's appropriate for all ages.
You can't help yourself if you're not aware of how you can help yourself. And Freeman Baldwin says Okemos students are ready to spread the word.
Put your socks on and ask people how they're doing. And if you're struggling, please commit to getting help, because the world needs you and you matter. And we want you here.
So if you're looking to spread awareness on suicide prevention and mental health, you can put on your colorful socks. Organizers say by doing that, you're pledging to encourage others to seek help if they need it. Here for you in Okemos, Rachel Ramsey, 6 News.
Thank you, Rachel. When we return, we're going to talk about trauma, how it contributes to our mental health issues, and what you can do to fight back when disaster strikes. We often think of a mental health crisis as something that's triggered by trauma, but it can just as easily be triggered by everyday things, including the stress caused by stretching to pay your bills. Trevor Duran sat down with an expert to talk about financial trauma and what you can do to fight it.
Lalsha Cunningham, thank you so much for joining us today.
Thank you so much for having me.
There are a lot of things that take a toll on people's mental health. I know job pressures or not having enough time in the day to finish stuff that you need to get done. But I have to believe making ends meet financially is maybe the biggest stress in people's minds. How much pressure is money?
Well, absolutely. Let me just say this first. There's 3 important parts of health, and that's our physical health, our mental health, and financial health. And that's really a new concept now to hear about financial health, which is the state of money. But it's very important because it really determines how we live our lives, how much, how many credit scores that we have. And also, I always tell my clients, it's also a huge part of our financial power.
Well, let's talk about things like a big, large debt, or if someone loses their job, there's going to be a huge financial impact. I know there's a thing called financial trauma. Talk a little bit about what that is.
Exactly what you just said is when they have a huge change to their finances, whether it's because of a job loss, whether it's because of overwhelming debt, which is also huge, what we think about perhaps a foreclosure, even in some cases repossessions.
What do you recommend if something happens like that? Because I know the anxiety and the pressure at that point has got to be at the 10.
That's why it's so important for us to have that emergency fund, because those funds will help us when we call it life happens, when unexpected events happen. Those funds will be able to carry us somewhat until we're able to secure another job. But it all starts with doing the savings so we can increase those funds. Without that, these are the causes that go into that financial trauma. That job loss, which also has an impact on our mental health. Anxiety, panic attacks, and then we think about physical health. When you think about, when you start to think about your money all the time, sometimes you start to have like chest pains. You have that, weird feeling in your stomach sometimes, and those are all health, physical health impacts. And it all really just comes from that one particular incident that started with perhaps could be a job loss.
So Cunningham, thank you so much for talking with us today. She's from Gesher Human Services. We appreciate it.
Thank you so much for having me. I appreciate it.
And we do know that tragedies do happen, whether it's a fire, flood, or another disaster. People can lose their homes, their belongings, even their loved ones. And while most associate the Red Cross with providing people with physical things like food and shelter, our Nate Salazar sat down with Helen Ostian, who's in charge of helping people with their mental health in times of crisis.
Now, you lead the mental health services for the Michigan region of the Red Cross. And I know after a fire or a flood or a disaster such as that, the first thing that we often associate with the Red Cross is meeting people's physical needs, like food, clothing, shelter. But I imagine it's just as important for people to deal with their mental health in that moment on top of the physical things. So what do you guys do to make sure that those needs aren't overlooked?
When people are affected by disaster, we have teams of mental health volunteers, master's level professional mental health professionals who can go to the scene of the disaster, work with people, talk with them about their experiences, identify their emotional distress, which is normal and common after experiencing a shock like that, and then follow up with them in the days and weeks, maybe sometimes even the months to come afterward.
What's the conversation like?
What we start out with clients identifying with them where they are in this process, and then listening to them, listening to their story. It's very important for us to follow along with what they need.
You help people after 9/11, Hurricane Katrina and Sandy, and lots of other disasters like that, major disasters. I imagine your job means you and your staff are meeting people at some of the worst moments in their lives, conceivably. So what are some of the first steps that you take when dealing with someone who has just lost their home or who maybe just lost a loved one?
Listen to their story. Sometimes people need to talk about their story. Sometimes they need somebody from outside of the event because other people around them are also affected. So having somebody from outside to be a listening ear and offer support and give them a sense of hope that they can get through this.
Thank you so much for joining us today and talking a little bit about this.
Thank you. Thank you.
While we often focus on the people whose lives are torn apart by tragedy, there's another group who are often overlooked, the helpers. While the tragedy may not be happening to them personally, first responders bear the brunt of disaster repeatedly. It's true of mass casualty incidents like the drunk driver accused of hitting a whole family, and of mass shootings like the one that happened at MSU last year or near downtown Lansing last week. And that's why departments are organizing mental health meetings and check-ins for first responders suffering from stress and strain.
We will come in and provide support to the team that responded to the incident. Departments are becoming increasingly more prepared. Your local departments have placed a huge emphasis on that. So there is typically support provided.
Well, we've talked about things you can do to get help with your mental health, but when we come back, we're going to talk about what the state of Michigan is doing and what it needs to do to make sure that people are getting the help they need. If you break your arm or if you get cancer, you know you can see a doctor because if you have insurance, you'll be covered. But what about mental health issues? Now you can sleep easier knowing that will be covered too. And that's because just last week, Governor Gretchen Whitmer signed legislation requiring insurers to cover treatment at the same level as physical health issues.
Right now, there are too many loopholes that allow providers to avoid paying for certain medical mental health treatments. They need to close these loopholes, and that's exactly what we are working on here. Senate Bill 27 achieves parity by requiring insurance to cover benefits in substantially the same manner with the same classification as medical and surgical benefits. It also gives us the authority to go after bad actors and raises the issue of substance abuse.
But while mental health advocates say they're happy about recent advances, they say Michigan has a checkered history with mental health care. Capitol correspondent Tim Skubic had a front row seat for many of those challenges. He's here for you now with a look at how things went in the past and how elected officials are trying to make things better in the future.
It was former President John F. Kennedy in 1963 who wanted to move patients out of aging and often dangerous insane asylums across the country and create a community mental health clinic system the federal money didn't follow to implement. Then, in 1992, Michigan Governor John Engler wanted to shut down the state's 16 psychiatric hospitals, including the Lafayette Clinic in Detroit. He ordered the state police to remove the patients. Many mental health advocates in the state think that was the low point in the state's mental health effort. But the legislative attitude in recent years towards mental health has flipped from cutting to spending. This mental health advocate gives lawmakers a score of 9 on a 10-point scale.
I give them a 9. I think they've done an incredible job this last year or two. There are some wrinkles, of course, as there always are, but very high marks.
The Oxford High School murders, COVID-19, and the MSU murders all raised the visibility of the mental health issue.
Yes, and it's sad to say, right? It takes such tragedies to do that. Kids and adults are talking about it more than ever. I think it reduces stigma.
I'm going to give the legislature a solid 8.5.
Ian Perry recalls in 1955 nationwide there were 350 beds for every 100,000 persons. The number is now 17, at a time when suicides are rising.
We've seen rises in rural veteran suicide. We've seen rises in women veteran suicide. We've seen rises in rural population suicide. And Native American, Alaskan, and Hawaiian suicide has gone up.
And it's a silent killer among first responders of all people.
Don't want to be pulled off the line. They don't want to be pulled out of the squad car. They don't want to be pulled off the job that they love to do. So we need helpers to help the helpers.
Students who suffered during the pandemic and now post-COVID got quality mental health care in the schools. But the federal money to pay for that is now gone.
Some districts made decisions to hire mental health folks.
On the legislative front currently, there is one silver lining.
I'm surprised folks on the far left and the far right all seem to rally around mental health needs.
But he confesses when it's a battle for dollars between public health and mental health, this is what's happening to mental health.
Though it's still at the bottom of the total.
Everybody agrees that more spending is needed. Here for you in Lansing, Tim Skubic, 6 News.
Well, thank you for joining our conversation about mental health. Remember, things will get better. People love and care about you, and help is just a phone call away. Just dial 988. Thank you so much for watching.